What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for December 13, 2020. What went wrong? The CDC and COVID-19. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Dr. Ali Khan, the Dean of the College of Public Health at the University of Nebraska and a former top official at the Centers for Disease Control and Prevention. Our topic is the CDC, its history, its struggles during COVID-19, and its future. Let's listen. Dr. Khan, thanks so much for joining me. Why don't you remind me of your career at the Centers for Disease Control?
Thank you, Dr. Sharfstein. Always a pleasure to catch up with you, Josh, given your work in public health over the years. Ali Khan, currently Dean of the College of Public Health here at the University of Nebraska Medical Center. But my career has essentially been at CDC. So I'm an internist, pediatrician. I started CDC in their disease detective program called EIS back in the 80s, and then spent 23 years there chasing Ebola, Rift Valley fever, Marburg all over the world. Eventually, I had to grow up and ran the Infectious Disease Center at CDC. And I also, before I left, ran the Health Security Program at CDC. It's about a $1.5 billion program that's responsible for keeping Americans safe from all public health threats, whatever their nature. So not just bioterrorism, chemical terrorism, but also pandemics and natural disasters. And that program had the Strategic National Stockpile, the Emergency Operations Center, our state program, and the program that monitors all the labs in the US that have the most deadly pathogens.
So when people say CDC is the leading public health agency in the world, what are they really referring to?
They are referring to an agency with a 75-year legacy of helping protect health here, not just in the United States, but worldwide. And we have now agencies worldwide that have changed their name to CDC to model what the US CDC has done in terms of what is the role of public health within our communities to ensure that people are healthy wherever they live, work, play.
You know, given your experience, what role would you see the Centers for Disease Control playing during a pandemic?
So based on what we have seen since CDC's founding, CDC has the central role for the public health science and what we should be doing. So CDC helps identify what the problem is, what the strategies are, and how to communicate that message out to the community so people can protect themselves. And this is what they've done, for example, in H1N1, which was a recent pandemic. This is what they have done with foodborne outbreaks. And as you follow CDC's amazing history further back, this is what they did during the HIV pandemic. I mean, CDC is your public health agency, the science of what needs to happen.
So it has not exactly played out maybe the way that some of us would have hoped or expected. And, you know, we've seen a lot of confusion about what the CDC is actually saying, things posted on the CDC site that turn out not to have been written by CDC, confusion about some of the messages, not a lot of briefings from CDC officials. You know, how would you characterize CDC's actual role as opposed to the role we maybe hoped that it would have?
Well, I think I would start at the impact, right? CDC is not functioning the way we would expect it to function. And so what we have seen is an outbreak that we've never been able to contain in the United States that's currently causing over 100,000 cases a day and 1,000 deaths a day. Right? And this is what happens when you divorce policy from public health science, which is what CDC gives you. So the story of what's happened during this outbreak is, for the audience, I call it biphasic. So basically, I link the disease to what's happened at CDC. So when people get infected, the first part of your disease is called the viral part. that gets you sick, and hopefully you get better. And then the second part is called the immune part, where your immune system attacks you, and that's where you get really sick. And that's where many people hear this term cytokine storm. So I think we've seen the same thing happen in the response. So at the early part of the response, there's no doubt that there were a handful of missteps by CDC in responding to this outbreak. And a lot of those missteps, some of them were due to lack of imagination, and some were just exposed long-term underfunding of the agency. For example, in their surveillance systems, right? They did not have modernized surveillance systems. We can just admit that. But then we moved to a phase when we started to essentially attack CDC itself and attack the science in an effort to downplay the disease and ignore the disease, potentially around this false dichotomy that you either had to focus on the economy or the disease, and not realizing the lessons from so many countries that have gotten this disease to zero, that if you want to fix the economy, please get rid of the disease. That's the way to fix the economy. And so what we have seen is a concerted effort to silence the voice of CDC. And we can say this with, I'm a CDC person, so this is an evidence-based statement. We have email trails that show numerous messages to CDC telling them to change policy, not publish policy. And I'll give you sort of concrete examples. For example, let's start with not testing patients who may be asymptomatic. Right? That was eventually CDC put out that policy, and then it was quickly reverted back to what CDC had originally said, which is you do test people who are symptomatic, right? Policies around how to open schools, when to open schools, what thresholds look like, all manipulated. And we have these emails from the former HHS spokesperson, Mr. Mike Caputo, and his henchman, Paul Alexander, essentially denigrating CDC, claiming that he's a better scientist than the 10,000 people at CDC who spend all day thinking about science, that he somehow has the ability to edit CDC science. And so we have lots of these examples of what's happened. And it's really sad because CDC, that's where you want your messaging to come from of what you should be doing.
I mean, for people who care about the agency and are worried about the public health, it's really been infuriating.
It's absolutely been infuriating because you see what the consequence of ignoring the science has been, right? There's a reason we have 100,000 cases a day in the United States. I've heard this term that we're rounding the curve. Well, yeah, we are, because it's a death spiral. And so we've been rounding it since March, right? And this is because we have not paying attention to these brilliant scientists at CDC.
So we may, it appears we will, have a new administration coming in and the opportunity to reset perhaps the pandemic response. And as part of that, the relationship with the agency. Before we get to that, though, I just want to ask you, how do you think people at CDC are coping with this situation? And what do you think is going to be necessary to help them feel like they're going to get another shot at this?
So there's no doubt that morale is low at the agencies. There's lots of reports from that, personal observations and conversations, that morale is really low when you're attacking the science and these individuals who've dedicated their life to the health of their communities. I can tell you, and you know this as a previously working for the feds, none of us do this for the money, right? This is about public service. This is about love for country, love for your fellow man. So morale is down. But that said, CDC is a learning agency. It always has been. And CDC, with the right support, will come back stronger and smarter than where it was at the beginning of this pandemic. That's what my prediction is for the CDC moving forward, that they would learn from what happened during this outbreak, improve their systems, and rethink their role in our communities, the role with the local and state health departments, rethink their role in equity especially. I'd like the CDC much broader involved in health equity issues moving forward and using their science to drive health equity. So I see a better, stronger CDC coming out at the end of this.
So it's not just going back to where we were right at the beginning of the pandemic, but actually really using the opportunity to rethink and rebuild the agency?
Absolutely. I hate the term the new normal. There's lots of things about the old normal I didn't like. Institutional racism would be one of them. Lack of health care coverage for everybody would be another example. Lack of paternal leave. So no, we need a bigger, better CDC at the end of this, not just go back to where we were back at January of this year.
So what would be the path to accomplishing that?
So I think there's a couple of ways to accomplish this. First is focusing back on the science. There's been an anti-science movement in the United States, and it would be nice to help people focus back on why science matters. And this, what's happened for the pandemic is just an example of what was happening with climate change, which is you denied the science of climate change, so you don't have to take any action. We just sort of repeated that for this pandemic. So increased focus on science, the primacy of CDC in our public health strategy and methods and execution and communication. It's sad when I look at the paper and I don't see something from Dr. Redfield every day, because that's who I want to hear from every day, representing these brilliant CDC practitioners. So the science needs to come first. And then the next thing is a rethink of the agency and the funding for the agency, and maybe rethink funding. I would like to see funding rethought writ large for public health. So, for example, a proportion of all federal dollars that go for healthcare will now go for public health. And then at least you have a steady stream of dollars to support public health, besides the one-off way, special projects way we tend to fund CDC currently. So funding differently, and then for them to sort of be thinking differently about what their health systems look like. Google knows more about our health than CDC and our local health department. That's absolutely crazy in today's day and age, right? We need to think about how do we ensure, with appropriate privacy protections and safeguards, that our public health agencies understand what's going on in health in their communities and working for that improved health. So lots of wonderful opportunities for the agency in the future. And hopefully Americans understand more now the role of public health.
Great. Well, it sounds like the agency's work will be cut out for it.
Without a doubt.
Thank you so much for joining me to share these thoughts.
Thank you very much, Josh, and always a pleasure.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.